Welcome to Direct Supply's Continuing Education webinar series. Direct Supply offers monthly webinars on a variety of topics throughout the year. The topic for today is what to look for in a skin protection cushion. My name is Robin Malik, and I will be facilitating today's meeting. Please note the information contained in this presentation is intended to provide general information, but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting with qualified legal counsel. Today's webinar will be presented by Endsjo. Anna is an occupational therapist with a Master's of Occupational Therapy degree from Nova Southeastern University and a Bachelor of Nutrition and Dietetics degree from the University of Delaware. Anna has worked as an occupational therapist for over 15 years, mainly with the geriatric population in a variety of treatment settings, including acute care, subacute care, outpatient, acute rehab, long-term care, and as a lymphedema certified therapist. Over the last 9 years, she has been dedicated to the betterment of the treatment of the elderly in long-term care centers. Her time was focused on seating and positioning and contracture management of the nursing home residents. Through this experience, her hope is to guide other therapists, rehab directors, nurses, and administrators through blogs, webinars, and live courses. And now, please welcome Anna.
Hello, and welcome to the 6th course of our webinar series titled What to Look For in a Skin Protection Cushion, Understanding the Principles of Immersion versus Offloading, and the Importance of Cushion Medium and Geometry. Today's objectives are that I would like for you to be able to name 3 characteristics that make a resident a candidate for a skin protection cushion. Next, I would like for you to be able to define the goal of a skin protection cushion. And lastly, I would like for you to be able to name 2 contours added to a cushion that assist in optimal pelvic alignment. So when going to purchase a cushion, the first step in choosing the appropriate cushion is finding the right category. And so understanding the categories of cushions out there is key. And most companies divide their cushions into 4 categories: standard, or known as general use cushions, skin protection cushions, positioning cushions, or skin protection and positioning cushions. But as you can see here on this algorithm, this decision tree that we have made, I call them standard cushions, skin protection cushions. I skip the positioning section and I go straight to skin protection and positioning cushions. And my thought process is anyone who is sitting with a positioning need is putting pressure on an area where pressure is not intended to be. So there's really no need for just that positioning cushion category, because again, anyone with a positioning need is placing their risk at risk for skin breakdown. So anyone with a positioning need really needs a skin protection plus positioning cushion. And so that you know, that standard section is really just a general use cushion that is an entry-level cushion that is good for someone with a basic need. They have no really special properties built into them to prevent against skin breakdown, to help stabilize the pelvis. They are truly meant to be for someone sitting for short periods of time that have no outstanding need. The skin protection section, which is what we're going to focus on today, whether it be within the skin protection category alone or the skin protection plus positioning category, is meant for someone who is at a high risk for skin breakdown. And the skin protection alone category is meant for someone that maybe doesn't sit in a postural abnormality, but has some type of disease process, diabetes, a nutritional deficiency, some type of circulation issue that really places them at high risk for wound development or for an existing wound to not heal. And then again, somebody with a positioning need may need that skin protection property built in as well, because they're sitting in an abnormal posture that places that skin under that bony prominence at higher risk for skin breakdown. So what type of resident is a skin protection cushion appropriate for? And all of your companies probably have some type of criteria that your clinical education teams have made that really allow you to see what category each of your residents would fit into. They've probably given you some type of checklist that names off things that you should be looking for that really place them in the appropriate category. And this list right here has actually been given to you from us. And it is in those seating and positioning guides that everyone who goes through our webinar series has been given. And it really gives you, as I said, some criteria, some checklists that you can go through and see. And if your resident, you can definitely say fits this criteria and this criteria and this criteria, then you know they would need that skin protection cushion. And they don't have to fit all of that criteria, but you know that if 3 or 4 of these criteria sounds like your resident, then most likely you're choosing the correct category. And in last month's course, we talked about those intrinsic and extrinsic factors of wound development. And if you recall, those intrinsic factors are things that are happening within someone's body, things that we as therapists may not be able to change directly. It's more of a whole team approach, the doctors, the dietitians, the nursing staff, that are really going to evaluate what medications are they on, what is their nutritional intake, and we kind of approach them as a team to see what changes we can make in order to prevent wound development. However, those extrinsic factors are things that are happening from the environment, that are affecting them from the outside. And these are things that we as a therapist can directly attack and change through our equipment choices in order to protect our residents from shear, pressure, and microclimate. So just to review very quickly what the extrinsic factors are, we have pressure. And pressure is that continuous force applied on or against the bony prominence of the pelvis and or trunk that happens when we're static, when we're not in movement. We're sitting statically and in a prolonged postural abnormality that causes constant pressure under a bony prominence and places us more at risk for a pressure injury. Whereas shear is occurring when our resident is in movement. And it is a combination of that downward pressure with the movement causing friction between the bony prominence that is in movement and the muscle and the skin tissue underneath. And the bone will go in one direction, the tissue and muscle will go in the opposite direction, causing that ripping, shearing motion that really permanently damages the tissue and the blood vessels. We also call this that silent extrinsic factor because it really shows no warning signs. Because it's happening between the bone and the muscle and the tissue and the vascular system, it's happening at the very deep muscle-bone interface, and it works its way up towards the surface of the skin. So unlike pressure that kind of tells us, hey, I'm here, there's a change of temperature of the skin, there's a reddening of the skin, this, by the time it rears its ugly head, the damage is at quite an advanced stage. And the last extrinsic factor is microclimate. And this is that buildup of excessive heat and or moisture at the seat surface. So where our body is making contact with the cushion or the back support, that really changes the skin integrity and makes it more susceptible to skin breakdown. So what is the goal of the skin protection cushion? We want to definitely try to minimize the risk of a pressure injury, of wound development, by reducing the effects of those extrinsic factors that we just reviewed, by providing and maintaining the individual's ideal posture, and by minimizing peak pressures off of the bony prominences onto a greater surface area where we will be able to get a more even pressure distribution. So instead of having the pressure enter into the skin right under the bony prominences like daggers, we'll be able to, make sure it's going over a greater surface area, a more even pressure distribution. And we do this by redistributing the pressure from the bony prominences to the areas of greater surface areas through offloading or immersion, which we will touch on again in a moment. We really want to try to stabilize the person in what is their neutral, most optimal position to prevent any forward movement of the pelvis or sliding into another type of abnormality like an obliquity or a rotation. We also want to utilize cushions that have those built-in features to fight that microclimate, that have temperature regulation, and that are air and moisture permeable. And we want to definitely be able to correct those flexible postural abnormalities or accommodate for those fixed postural abnormalities to prevent further progression. So we now know when we need to choose the skin protection cushion. We know that they are fighting the intrinsic and the extrinsic factors of wound development. We've looked at our algorithms, and we know that we need skin protection properties in our cushion, that general standard use cushion won't cut it. However, we have to understand three very important principles when looking at a skin protection cushion. And the first principle is the method of pressure redistribution. Would they be better off with an offloading cushion or an immersion cushion? The second principle is that we need to start to understand the cushion's geometry. Will this particular resident do better with a flatter, more linear, zero elevation cushion? Or is their body asking for something with a little bit more contour, with those hills and valleys that really lock them into the cushion and stabilize them? As well, we need to start to understand cushion medium. And, you know, in the past, there has been some misconceptions when it comes to mediums. And there are certain people that think, you know, gel is the way to go or air is the way to go. And in my opinion, it's not so much that one medium is better than the other. What you really need to consider, because we have come a very long way in terms of constructions of cushions, but what we really need to understand more than I need to choose gel over air or over foam is what is the actual quality of that particular medium that you have chosen. Because one medium may work like a charm for one, but not for the other type of resident. But what is consistent among them all is that we have to choose the highest quality medium, no matter what that medium is. So the first thing we need to understand is the method of pressure redistribution. And as we learned in the last course, there are two methods of pressure redistribution for combating those extrinsic factors of pressure and shear. And they are offloading and immersion. And they both have the same idea. They both want to take pressure off of a small surface area right under those bony prominences and redistribute the pressure to a greater surface area. But how they do so is very, very different. So in review, offloading is really looking at the principle of taking pressure off of a small surface area and protecting the skin right under that bony prominence and trying to load it to an area of greater surface area, so more on the greater amount of the gluteal surface and down the femur, so that we can stop the pressure coming in like daggers and putting it on a greater surface area with more even pressure redistribution. We start to float completely or partially where the bony prominences are, the high risk areas, and place the pressure on a lower risk area. However, when we use offloading cushions, there's always some benefits and there's always some considerations. So some of the good things that we gain by using an offloading cushion is that it is a firmer surface. It kind of creates a safer end feel for the resident because you have those hills and those valleys that make those contours that kind of make the person fit into the cushion and really lock that pelvis in. And so it makes the person feel more stable. It adds to the stability that that person lacks due to having, you know, poor trunk or pelvic strength, and it really makes them feel like they are locked into the cushion and they feel safe. And it really prevents any unwanted movement onto those bony prominences that are at higher risk for skin breakdown. As well, because of the contours of the cushion, it develops and delineates a place for the pelvis. It makes an area that's deeper than the rest of the cushion where you can literally partially or completely suspend those at-risk bony areas like the ITs, like the sacrum and the coccyx. And it really helps through the contours to load greater surface areas such as the trochanter and down the femur so that we can have optimal offloading. However, just like with anything, we need to be careful. There are certain things that we have to look at and we have to decide, what is my person's construction, what is their need, and is this the correct style of pressure redistribution for my patient? So the first thing, and the very obvious thing, is that it would not be good for someone who has a trochanter wound. It is very important for us to understand where is the wound that our resident presents with. And due to the nature of this cushion, it actually loads the pressure onto the trochanter head. Then obviously we don't want to use this style of cushion with someone that is where their wound is presenting. As well, this style of cushion, because it is firmer, it has that firmer end feel, may not be good for someone with a hypersensitivity that really doesn't like that firm end feel, that it presents to them as almost painful. And again, even though this cushion in theory may do everything we want for that resident, it takes the pressure off of that IT in the sacrum, the coccyx. It loads it onto an area of greater surface area and through the femurs. However, it's a personal preference. And then at the end of the day, if this resident doesn't like the end feel, then it's not appropriate for that patient. And as well, that through the nature of the contours adding more stability, it makes it more difficult for someone to transfer out of this cushion because it kind of locks them in. It really gives them that stability. And so you may take someone that might have been an independent transfer off of a more linear flat cushion, and because it locks them in and really adds that stability, it may take them from an independent transfer to a min-assist transfer because it is a little bit harder to get out and over those hills and those valleys. As well, if you're dealing with someone with a very significant fixed contracture, they may not fit into those pre-contours. The second style of pressure distribution is the immersion cushion. And this is when I talked in the last course about that Easter egg and that Easter basket, and how when we have an Easter basket, we fill it up with all of that fake fluffy grass. And when you place the egg inside, the grass kind of gives around it and immerses that shape of the egg and really goes around the apex, protecting it and protecting that apex from cracking. And it is the same concept with an immersion style cushion. So what it does is it takes a person, and instead of sitting on a flat cushion with no immersion properties, where the bony prominences would be jutting into the cushion, it allows us to sink the person into the cushion. It allows us to wrap around their curvature and protect their bony prominences. So instead of all the pressure entering like daggers just where the bony prominences are jutting into the cushion, it allows for us to wrap around the person, contouring to their curvature, making contact with a greater surface area and really protecting those bony prominences. So what are the benefits of using an immersion style cushion? Well, the first thing is that it gives you a softer end feel. So when you're dealing with a person that pain is a huge issue, they may prefer this kind of cushion that feels softer and feels better on their bottom. Another benefit of using this style cushion is that, as I said, it envelops, it wraps around the person, it captures their exact curvature, so that instead of just making contact with small areas, it's making contact with the entire surface, the gluteal surface, the entire pelvic surface, and all the way down the legs and throughout the femurs. As well, because it wraps around it and it immerses and sinks you into the cushion, it really protects those bony prominences. And you can see this is a pressure map of someone without an immersion style cushion, and you can really see that those bony prominences are jutting into the cushion, hot red. And once you're able to envelop them and capture their shape and sink them into the cushion, then you can see that you have really reduced those peak pressures, and the hot red is completely gone. As well, this type of cushion is good for any type of wound at any stage. So you're not running into that issue of if they have a trochanter wound, you've got to be careful, because it doesn't matter if it's a trochanter wound or a coccygeal wound, it's going to emerge wherever that wound may be at any stage. As well, it may be easier for an independent transfer because it's really not stabilizing you, locking you into a position to prevent unwanted movement. It's allowing you to have a little bit more freedom of movement. But like anything, there are definitely some considerations with an immersion style cushion. And one of the main considerations is that it's not as stable of a surface. It doesn't have those contours. It doesn't lock you in. It doesn't really give you the stabilization that your patient's body may lack. So if you're dealing with someone with an extremely weak trunk or pelvic musculature, or someone with a progressive disease that they have a very different level of endurance in the morning than they do in the afternoon, you're trying to force this person to make up for the stability that the cushion construction lacks by using their core strength. So if they don't have that core strength, you may see them fatiguing a little bit more quickly on this style of cushion. They may start to lean or slide down or slump over a little bit more quickly on this style surface if core strength is quite an issue. As well, it may not be suitable for someone who does want that proprioceptive input, who does want that firmer surface that really gives them the borders, gives them the guides to align their low extremities, to align their pelvis, and really lock it in to help with stabilization. And also, the other thing you really need to think about is the fact that some immersion style cushions really need some type of maintenance. And if they're not maintained, they can kind of deflate. So there's some air, there's some gel that you need to be checking on a daily basis. And if it is not at the correct inflation level, or if the gel has dispersed too much, then those bony prominences can really be touching the firmer base of the cushion or even the seat sling itself, and it's almost mimicking as if you just don't have them on a cushion at all, and you have all of that pressure going straight on to the bony prominences. Okay, so now the cushion geometry. What is the shape of the cushion, and who should I be using it with? So the first cushion we're going to look at is a linear zero elevation cushion. And when I talk about a zero elevation or a linear cushion, this is referring to a very flat seat cushion. And you can see that very well. We have drawn this blue line on all these different styles of cushion to let you know it doesn't have those hills and those valleys and all that shape to the cushion that's naturally built into it. It's a flatter, flatter cushion. And it can be made of pretty much any medium. It can be foam with gel, it can be air. And when you're using this type of cushion for skin protection, it's really the quality of the medium that you choose that is essential. It doesn't matter if it's foam or gel or air. You need to think about the quality. And we're going to get into that in a little bit more depth in just a moment. So a zero elevation cushion is the people that you want to use this for is someone who really needs that freedom of movement. So maybe this is a resident that is very independent with their ADLs, and they need to reach their feet to put on their socks and their shoes and put their underwear on and take it off. And so when you're using more of a contoured cushion that has those hills and valleys, it kind of increases the depth of the front of the cushion or the side of the cushion, and it can really make it difficult for someone to reach over those hills and valleys to reach their feet. So it could make it more difficult, whereas this linear cushion, which is a flatter cushion, allows them to reach their feet easily, allows them to reach out of the cushion in order to perform their ADLs. Another huge benefit of a linear cushion, a flatter cushion, is the fact that it will fit any body type. So maybe I'm someone that's a little larger, I have more residual tissue. Maybe you're someone that's very tiny with your very prominent bony prominences that are just jutting out everywhere. Maybe I have a contracture and you do not. It doesn't matter, because this type of cushion takes the shape of whoever is sitting into it. It is going to be able to be used from one body type to the other with no difficulty. As well, just as I mentioned, it can really accommodate quite well for a contracture because it is taking the shape of my body. So if I have a leg length discrepancy, or I have one side of my hip is contracted in flexion or extension, it's going to accommodate for that because it's going to take the shape no matter what my shape is. And it does a great job of enveloping every individual shape and really protecting those bony prominences. So here you can see a great example of an immersion style cushion that when the resident sat on it, you can see that it took exactly their shape and was allowing those bony prominences to be immersed inside of the cushion. However, as I mentioned before, Medium is huge when it comes to this type of cushion and the quality of the medium. So with a linear cushion, you have to be careful when it comes to using those traditional gels. Because what happens is when you sit that person on the cushion and the bony prominences start to, go inside and it starts to immerse in the cushion, if you're using a lower quality gel, that gel disperses away from that pressure under that bony prominences. And so if you allow that gel to disperse over time and you don't maintain the cushion and you don't need it after every reposition or after every day when you're going to put the person on the cushion again, every time you place that person on the cushion, the gel disperses more and the bony prominence can actually make contact, as I said, with the very stiff, firm bottom layer of the cushion, or even worse, the seat sling. So it's as if they're just not even sitting on a cushion. As well, if you're using a very low quality foam, the longer the person sits on the cushion, the more that foam is going to compress. It's going to lose its shape, and again, it's going to be as if that person is sitting without a cushion, because you're going to have those peak pressures going straight up into the bony prominence. And it's the same with air. Sometimes with an air cushion, it loses its stability through its construction, and so you need to constantly be maintaining this type of cushion. You may even have to use a rigid insert in order to provide the stability that these kind of cushions lack. And if you don't maintain that air, again, if it's overinflated or underinflated, you can actually cause more harm. You can cause more pressure to be directly onto those bony prominences. And as well, this type of cushion usually results in less stability, making someone fatigue longer, with shorter periods of time. So if you're dealing with someone with very weak core strength or pelvic strength, because this cushion just doesn't have the same stability as a cushion with those pre-contours, those hills and those valleys, if they don't have that core strength, they will fatigue quickly. Okay, so now talking about those pre-contoured cushions, those cushions that have those hills and those valleys, who would benefit from this type of cushion? Definitely those people that have the core strength, the weak pelvis, the weak trunk, doesn't have the balance and endurance to try to sit up against a more unstable cushion for long periods of time. So when you have a cushion with these built-in hills and valleys, then you're making up for the lack of strength that that person has. It's also good with someone with decreased range of motion that might have a minimal to a moderate orthopedic deformity. So you can actually make up for that by locking that person's pelvis in, accommodating for whatever contracture they may have, and decreasing any type of unwanted movement in their chair. It's great for someone with prolonged sitting because of the fact that it helps to really stabilize the person. It locks the pelvis in, it aligns the lower extremities, and so they're going to be able to sit in that cushion for long periods of time without compromising their postural alignment. And it's also great for people that are at very high risk for skin breakdown due to excessive movement in the chair. Again, due to the fact that it really stabilizes the pelvis, it locks it in, aligns the lower extremities in what their optimal position will be. So as you can see, in these cushions up here, they have those hills and those valleys that I'm talking about. You can see here the medial abductor, you can see the lateral adductors, you can see the posterior pelvic well, and you can see it's those hills and those valleys that really lock the person in. And the components of a pre-contoured cushion are adductors, and they can be either tapered or straight, and we'll discuss both. You can have a posterior well, which is back here, if I can get my mouse working, the posterior well back here. You also have the medial abductor. These are the adductors, and this is the medial abductor. You can also have an anti-thrust component to your pre-contoured cushion or a wedge. So the adductors, they come in two styles. They can come in straight adductors or they can come in tapered adductors. And the difference is that the tapered adductors are thinner in the front and they get wider in the back. And so the two different shapes have very different functions, and we're going to review both. So we're going to start with the straight adductors. And the straight adductors can either be run the entire length of the cushion, or they can be just in the rear of the cushion, or they could be just in the front of the cushion, or they could be just on the left side or the right side. But what they do is they act as a boundary to assist with lower extremity alignment. So they really provide a border for, some proprioceptive input to really prevent abduction of the leg, for the leg falling off the side of the cushion, the leg rolling out of the side, that will then shift their pelvis into an unwanted posture. So a benefit from using these straight adductors is that, as I said, it provides some proprioceptive input to the lateral surface of the leg that really helps with that midline alignment of the lower extremity. And of course, if we can align the lower extremities, we're going to be able to keep the pelvic alignment even better. The second type of adductor is the tapered adductor. And what's interesting about these adductors is that it's thinner in the front and it gets wider as it goes towards the back of the cushion. And it does this so that it can form a shelf where the trochanters will sit. And the reason why we want that shelf is when we talked about that offloading cushion, if you remember, we talked about the fact that we offloaded the pressure and loaded it onto the trochanters. And the way we can do that is by placing them on that shelf. So it locks the head of the femur into the acetabulum, which is the C-shaped area where the head of the femur goes into. And so when you place the trochanter on this shelf, it helps to push the femur head into the acetabulum, stabilizing that pelvis quite well. The other thing that it can do is it helps to make a posterior pelvic well where you can offload the ITs and the sacrum and the coccyx to really partially or completely offload those high-risk bony prominences. So again, the benefits from using a tapered abductor is that you get that offloading. You get the optimal offloading by taking the pressure off of these bony prominences and loading it onto the trochanter head and down the femur through the shelf that these tapered abductors make. It allows for that pelvic stability for someone that really doesn't have that trunk and pelvic strength. And it prevents unwanted shifting in the chair because it stabilizes that pelvis. It locks the head of the femur in. It aligns the lower extremities, and it takes the pressure off high-risk areas. Okay, so we talked about how the adductors help to create this posterior pelvic well. So this posterior pelvic well, what it does, it really delineates where the pelvis is supposed to be on the cushion. And if you remember from one of the very first courses in the webinar series, we talked about the fact that the best cushion on the market can't do its job if the pelvis is not sitting in the place where it is intended to be sitting. So it is supposed to be in the posterior pelvic well. But sometimes if we don't get the person's positioning correct, sometimes the pelvis can be sitting up here on the abductor or on an adductor that is a little bit firmer of a surface, and you're going to be making that resident more susceptible for pressure injuries. So this is the reason that these contoured cushions really make that posterior pelvic well. It delineates where the pelvis is supposed to go. It helps as a guide. It kind of sinks that person into that area of the cushion. And that, in combination with the lateral tapered adductors, will load the femurs, and it will partially or fully suspend those ITs, the sacrum, and the coccyx. So the area that is at high risk for breakdown is now almost completely or partially suspended thanks to this deep posterior pelvic well. The next component of a pre-contoured cushion is the medial abductor. And that's the piece in the middle that really helps to prevent someone whose legs want to come together. The knees want to touch and rub against each other. So that medial abductor in relation with the lateral adductors help to form leg troughs. And these leg troughs are where your legs will rest in to help with alignment. And you can see that quite well in this picture right here. So those abductors, again, are going to prevent someone's knees from coming together. It goes right in between the legs and prevents the knees and the legs from coming into midline, helping to promote lower extremity alignment. And when it's used in combination with the adductor, you can see it makes a nice little leg trough for the legs to lie into and make sure we have optimal midline alignment of the lower extremities. But one thing we always need to make sure of is that we're really considering someone's anatomical shape, because maybe someone has a significant contracture and they will not fit into these leg troughs or into this pre-contoured shape due to the lack of range of motion that they may have. So the next component is an anti-thrust. So what does an anti-thrust do? And again, just like most of the other components of a pre-contoured cushion, it acts as a boundary. It's meant to minimize any forward migration of the pelvis into a posterior pelvic tilt. And what's interesting about this cushion is that, it's just a little tidbit for you to know, is that it's supposed to be placed about halfway up the cushion. So if this were an 18-inch cushion, the anti-thrust would be about 9 inches. And you often see it used with someone with very significant extensor tone. And we can all picture this. We have that resident who really thrusts their back against the back support and lifts their pelvis and kind of pushes it forward towards the front of the cushion. And it's supposed to stop that thrusting movement of the pelvis trying to go towards the front of the cushion, hence the term anti-thrust. The next component could be a wedge. And what does a wedge actually do? Well, a wedge is something that actually closes the seat to back angle. So if we have a chair here, this wedge goes in this way. And we talked about very extensively in the first couple courses the benefits of opening seat to back angle. And when you have a resident that has a range of motion limitation that can't tolerate sitting in a fixed 90-degree chair, you want to try to increase the angle from 90 to about 105, 110. So you've got to understand that this wedge actually does the exact opposite. It closes the seat to back angle, and you can see that here. And the higher the wedge is, the more you close the seat to back angle. So we need to be very careful when we use wedge cushions. And it's used to maintain pelvic position for certain pelvic abnormalities. And I'm going to talk a little bit about a misconception with the wedge, because I really believe this is a component that is a little bit overused. I am not a big fan of the wedge cushion. I do know it has its purpose, but I think that sometimes we use it for the wrong reasons. So what I want to just make sure you understand is that we need to know exactly what the wedge is actually doing, and are we using it with the correct person. So when we place a wedge in a chair, especially when we're putting it in a chair like a K1 or a K2 or a K3 that has that fixed 90-degree angle, we are closing the seat to back angle more and more and more. So if your resident can't tolerate 90, I doubt they're going to be able to tolerate the 80 or the 70 or the 75 degrees that you're now closing when you place a wedge cushion in. The other thing is that we have to be careful when we're trying to prevent someone from sliding out of the chairs. We learned about the fact that a lot of times the reason is because the resident has shortened hamstring muscles. And the hamstring is attached to the pelvis and to the knee. So as this hamstring shortens, it pulls on the pelvis and it brings that pelvis forward into a posterior pelvic tilt. So when we place a wedge cushion, we are actually shortening the hamstring muscles even more, which are going to bring your resident to more of a posterior pelvic tilt and increase the risk of them sliding out of that chair. The other problem that we have is that as we slide into more of a posterior pelvic tilt, those bony prominences of the ITs and the sacrum and the coccyx are now making more contact. Instead of taking the pressure off of the bony prominences, we're putting it more on the bony prominences because they're now making contact with the incline of this wedge cushion. So we really have to think of who should we avoid using a wedge with. So if we are trying our hardest to stop the progression of a posterior pelvic tilt, stop the progression of tightened hamstrings, stop the progression of an IT sacral or coccygeal wound, we're trying to stop the person from sliding out of the chair, and we know that we're dealing with a person who cannot tolerate less than 90 degrees, they actually need something more like 100 or 110, then we probably should not be using a wedge with this type of individual. Who could use a wedge? So like I said, I know that there is a place for the wedge and it's not completely a bad thing, but you need to understand who you should avoid it with and who you could use it with. So when your goal is to reduce very heavy extensor tone, this might be a good option. The other thing is that when you're dealing with someone, that range of motion is not that big of a deal. When you take them out of the chair, they have good range of motion at their hips, they have good range of motion at their knees, they don't have extremely tightened hamstrings, then maybe you can use this type of cushion. And lastly, it can be really good in a custom cushion that maybe only half of the cushion is wedge in order to accommodate for a contracture or range of motion limitation like a flexion contracture at the hip. However, we always, always, always need to consider the person's hamstring tightness, our resident's flexibility at their pelvis and then at their knee, what is their range of motion. So if we do use a wedge, we are not actually promoting the deformity, promoting the skin breakdown. And I'm not going to go over this slide, but it's almost like an FYI. And again, this slide has been taken directly from the seating and positioning guide that we had given to you. And these are just some other methods, other things to think about. Instead of using a wedge, try to do some of these things to prevent that forward sliding out of the chair. And again, I'm not going to go through them. This is given to you as a resource in the seating and positioning guide. So pre-contoured cushions, obviously there are some benefits to them. And one of the greatest benefits is that it promotes great pressure redistribution to those greater surface areas, reducing the peak pressures from the contours, from the hills and the valleys that are built into this cushion. It really increases stability because it locks that femur head into the acetabulum. It really locks the pelvis into place. It helps with lower extremity alignment through the contours. So it really gives you that optimal position depending on what your resident's needs are. And it can really accommodate or correct any type of postural abnormality. However, just like with everything, there are some considerations. And various body types and shapes and sizes may not always fit these contours. I may be someone that just the way that I have my construction, the way that my fat is distributed, maybe I don't fit into that cushion. Maybe I have severe contractures and I cannot fit into that predetermined shape of that cushion. Also, you have to understand that, as I mentioned before, it can restrict freedom of movement. Because of those hills and valleys, it makes the cushion thicker in different areas. It makes definitely the front of the cushion thicker. It makes the side of the cushion thicker. So it may make it difficult for someone to lean forward, reach their feet, to put on their clothing, to take their socks on and off, their shoes on and off, tie their shoes, and reach outside of the wheelchair. And again, those aggressive contours may make it difficult for an independent transfer. So again, if you're dealing with someone that might have some weakness in their trunk or their pelvis, it might make it a little bit more difficult for them to get out of those contours and transfer to the toilet or to the bed safely. And you may be taking someone from an independent level of transfer to maybe a min assist or more. Okay, so moving on to cushion medium. And this is super important to understand because no matter what the medium is, quality is the key factor. So the first medium we're going to look at is foam. And we're going to talk about the quality of foam, the types and properties of foam, some benefits and considerations. And the first thing I want you to understand is that not all foams are the same. Again, I mentioned over and over that the medium really depends on its quality. And when we're measuring quality of foam, we're actually talking about the foam's density. So one misconception when it comes to foam density is that people often think that there's a correlation between density and how hard or soft a cushion may be. They feel that a high density cushion is probably a very hard, firm cushion, and that may not be the case. A very high density foam can be both soft or firm. So how do we measure foam density, which measures, at the end of the day, its quality? So what manufacturers do is they actually take a 12 by 12 by 12 block of foam and they measure just that 12 by 12 by 12 block. And once they measure it, if they find that it measures to be more 1 to 3 pounds, then they know that that is a higher quality foam that is good enough for someone who needs to sit on that cushion all day long. If you're looking at a weight less than 1 or less, really, then you know that's probably more talking about like a general use cushion that's meant to be sat on for a couple hours a day, but not for our long-term care resident. It is sitting hours on end. And anything that is above 3 pounds, if this block of 12 by 12 by 12 is more than 3 pounds in weight, this is considered to be a very high quality foam, something that you should be looking for so that you can maintain its ability to either offload or immerse those bony prominences for that skin protection. And what I really want you to understand from this slide is that there is no way that the manufacturer can offer you a cushion with a very low cost, a $30, $40 cushion, and it be of high quality that can then uphold against high pressure sitting on it all day long. In order to get a high quality foam, the manufacturer needs to pay, and they're not going to be able to lose money by putting a high quality foam in a cushion, but then turning around and giving it to you for a super low cost. There's no manufacturer out there that can do that. So understand and really start to scratch your head when you're like, all right, I'm buying this this cushion with a very low upfront cost, but what did they have to sacrifice in order to give me that cushion? And I can guarantee you it's the quality of the foam. So as I mentioned, there's two main types of foam. There's the high resiliency foam, HR foam, and this type of foam is foam that actually, ding, kind of springs back immediately after you take someone off of it. So if you can look at these pictures right here, a high resiliency foam, when you put someone on it, it's going to do exactly what it's supposed to. The foam is going to give, but when you take the person off of the cushion, it's going to spring back to its original shape immediately after the person has been taken off. The other type of foam is called viscoelastic foam. And this is a memory foam, and meaning that it actually remembers its shape. It takes a little bit longer to resume its original shape because it remembers the shape of the person that has sat on it. So again, if we look at these pictures, we place someone on the viscoelastic foam. And what's interesting about this type of foam, instead of just giving like this high resiliency foam, the viscoelastic foam is once you place someone on it, it actually gives and takes the shape and contours to the person's shape. So then once you take the person off of the cushion, that foam remembers the shape. It remembers the curvature of that person. So I guess your wheels are already spinning. You're kind of starting to think what these two foams could be good for in terms of a cushion. So going back to this high resiliency foam, it's a more durable foam. It can withstand repeated compression and maintains its resiliency over time, which means that it adds a lot of structure and stability to a cushion. So this is great for use in a cushion, but as the base of a cushion so that it doesn't hammock, so that it provides the stability that the cushion needs. So again, this is great for the bottom layer of a cushion to really allow it to be stable and not hammock. However, the viscoelastic foam allows for wonderful immersion because it gives with it. It captures the person's shape. It contours to the unique shape of the user, and you can see that with this picture here. So this is great for use for the top layer of a cushion. So again, the high resiliency would be good for a bottom layer to give it stability. And this viscoelastic is great for the top layer, which is going to be immersing the person, capturing its shape, and really taking pressure from those bony prominences. So the benefits of using foam, like we just discussed, is it can be designed to be as supportive and be the base of a cushion, or it can be be contoured as needed to be the top layer of a cushion. So that's excellent. We can use foam for two totally different purposes. It can really allow for the offloading and immersion, so you can make those contours with a little bit more of a high resiliency foam that will then be able to be the borders and the boundaries, or you can use that more memory foam that can immerse those bony prominences in, taking off those peak pressures. And the other wonderful thing about foam is it's very low maintenance. So there's really nothing to do. You don't have to check air pressure. You don't have to make sure that the gel is massaged and kneaded so that it's not dispersed completely away from the bony prominences. It's pretty much maintenance free. However, with foam, it can be very heavy because remember, we measure the density of a foam through its weight. So the higher the weight, the better the quality of the foam. So if you're dealing with someone who is an independent, they have independent propulsion of the chair, sometimes that can add a lot of weight to the wheelchair system and can make an increase of repetitive strain injuries because you're definitely adding weight to this elderly population, making it harder, putting more strain on the joints in order to propel the chair, whether it be with their arms or their lower extremities. As well, you need to protect the foam from incontinence. So I highly recommend, if you're using foam cushions, definitely add those incontinence liners to the cushions. You don't want that excess moisture to enter the cushion, because then pretty much it's ruined. It's going to keep that smell, it's going to keep that moisture. And most foams are inherently hot. They retain heat. And they retain that moisture. So again, you need to really think about the fact that it's going to retain heat, it's going to retain moisture, and what that's going to do in terms of microclimate. Okay, the next medium to talk about is air. And we're going to look at the styles of air, properties, benefits, considerations as well. And so air cushions are excellent immersion style cushioning. Again, that cushion that sinks the body in, takes the shape of the individual, captures their abnormal curvature or normal curvature so that you can get a greater even pressure redistribution. And air cushions are made up of air cells. They're flexible air cells that shift and conform around the shape of the user to really immerse the person in and protect those bony prominences. And such as this one, some styles of air cushions allow flow between air cells. So the pressure moves away from the peak pressure. So when you sit someone on a cushion like this one, they sit on and the air will go away from under the bony prominence and go to other air cells around to kind of protect that bony prominences from having any upward pressure from the seat surface. Other styles of air cushions are made up of like little tiny individual air cells. And these individual air cells shift around the user's shape to really protect the bony prominence, that are in constant readjustment with every weight shift. So every time you move, the air cells will shift with the person, constantly protecting the bony prominence no matter where it is as the person shifts on the cushion. As well, because of its natural shape, it actually will always bind together and really add some stability to the cushion to kind of prevent that fatigue that we talked about. So you can really use this style of cushion with someone that has a weaker core. That even some air cushions have some built-in contour. You can see a medial abductor here. And so some air cushions even have some built-in contour that also really allow for that positioning need, add that stability like I was just discussing. Okay, so the benefits of using air is that it has an excellent way of enveloping the body, immersing those bony prominences to increase pressure redistribution, to have a greater surface area because you're capturing the entire pelvic surface. It is perceived as soft and very comfortable to most users. So when pain is a big issue, this is usually the preferred surface of a lot of people dealing with pain issues. And it can be adjustable. You can inflate it a little bit more, deflate it. The air cells, some of the air cells can be taken out or placed in to accommodate for postural abnormalities. But some considerations with air is that certain styles require frequent maintenance. And think about that. We all know some of those cushions. They tell you, the manufacturer is not, they are completely honest and tell you, you need to check daily to make sure it's not underinflated or overinflated. And if you do not check that, you're placing that resin at risk for the bony prominences to get closer and closer and closer to the seat sling, or to the firm base, the firm foam that might be underneath, or even touch the seat sling. So it's almost as if they're not even sitting on a cushion. As well, certain styles are not as stable. And again, someone with more core strength, pelvic instability, it can make them fatigue over long periods of time sitting on these styles of cushions. And as well, this is a big thing to think about, is where do you live? Do you live in an area with high altitude? Because higher altitudes actually make the air firmer. So something that where I live in North Carolina might be fine. If you're living somewhere where up high in the mountains, it may seem more firm. It may seem like they're sitting on a rock just because of the difference in the altitude. Okay. other materials, we're going to look at them, their properties and their benefits. And the first one is gel and fluid inserts. And in the past, this was perceived to be one of the best mediums for skin protection. And that is just not true. They're just as good air cushions, foam, and so forth. The constructions of the cushions have come a long way. Some benefits of using gel or fluid inserts is that, again, it allows for good envelopment, good immersion of those bony prominences to increase pressure redistribution. And some gels actually have kind of a cooling effect to really fight that microclimate. However, some considerations, and some very serious considerations in my opinion, is that their effectiveness completely depends on the geometry and the stability of the lowest level of the cushion. So sometimes they can be a very unstable surface, it provides minimal pelvic stability, and it may make it difficult for that person to transfer or even to maintain their stability for long periods of time on these type of cushions. As well, gel has a high tendency to migrate and disperse away from the bony prominences with prolonged pressure, with the prolonged pressure coming down through those jutting bony prominences. The gel underneath of it disperses away. And if you do not knead those cushions and you do not massage them daily, then you're going to have those people's bony prominences jutting very far down, making contact with the seat sling or making contact with the firm foam surface underneath. So again, it may be as if they're not even sitting on something because all of that gel has dispersed away. Also, with sun exposure, they retain a lot of heat, and the residents can say that this has become very hot, and you're increasing the risk of microclimate affecting that person. As well, it's more susceptible to damage. That gel is more susceptible to leaks where the gel can come out of the area that it's designated to be in, and then it's not going to be able to do the job that it's intended to do. One style of cushion that I have to admit that I use quite a bit of when I was a practicing therapist, and this is a honeycomb cushion. And I had some success, lots of success with these cushions. These cushions are made of a thermoplastic material using a hexagonal honeycomb shape. And some of the benefits of these cushions is it's very lightweight. So you can, someone who propels a lot, again, you're reducing the risk of a repetitive strain injury because it is a lightweight. It's not adding a ton of weight to the wheelchair system. They inherently are breathable, so you can really address that microclimate because of these honeycomb shapes. They allow for freedom of movement. They don't have a lot of contour built into them, so they're more of a linear, flatter cushion that really allows someone that is an independent person when it comes to their ADLs to reach anywhere and everywhere they need to in order to perform their activities of daily living. And they're pretty much no maintenance. They really are probably one of the lowest maintenance cushions on the market. However, I did have some pretty serious considerations, and it would actually make me have to take the cushion away and find something else, is the fact that it's really not adjustable. So as my patient kind of got sicker, older, I couldn't adjust for postural abnormalities, and so I really couldn't accommodate for any type of orthopedic deformity. As well, residents, again, with that core strength issue really had issues with balance and endurance on this type of cushion because it is more of a linear cushion. It doesn't lock the pelvis in. It doesn't help stabilize what in a person that's lacking the trunk and pelvic stability to stabilize themselves. And as well, it's quite hard. A lot of my residents did not like the end feel that was very firm. It is a very hard, firm end feel. I had some great outcomes with this cushion, but a lot of my residents just could not tolerate how firm the end feel was. And so at the end of the day, I had to take the cushion back. And then we have those combination cushions. And this is the combination of foam and air, or foam and gel. And the style is dependent on the manufacturer. And what something is good about it is because it has foam, you get a very stable base. And it also has those pre-built contours that allows for that added support, that pelvic stability, that optimal positioning, and that lower extremity alignment. However, some considerations is that, again, they can be very heavy because you're using a lot of different mediums, and so you're setting someone up for a repetitive strain injury if they're a self-propeller, as well as where those cutouts are. If the gel disperses away or the air deflates, then you're really placing the person against the ridge, the hard ridges, and placing those bony prominences at higher risk for peak pressures. And you need to maintain whatever it is in the middle, the air or the gel. So you have to kind of make sure that you're still maintaining the cushion. It's a little bit higher maintenance than just straight up foam. So again, when we're choosing a skin protection cushion, just remember there is no miracle cushion that is perfect for every resident. You have to do the research yourself. We as therapists are responsible to understand the properties of the cushion to best provide the best skin protection cushion depending on what our residents' individual needs are. You need to know the pressure redistribution and what method will work best with that particular resident. You need to look at the geometry. What is the shape of the cushion? What are their function that they need to do? And so if it's someone with more of an independent ADL, then you need to look maybe for more linear cushion. So again, you need to understand what the geometry does and how that's going to affect their ADL function. And definitely you need to know the medium and what the quality of that medium is, because there are benefits and considerations with each one, and every resident cannot use the same exact medium. What might work for one will not work for the other. And it is our job to do the investigation of why. If you see a cushion and it has this great cheap upfront cost, make sure you're investigating the why, because I can guarantee you that most likely the quality is what has been sacrificed. I hope you found this course very helpful. Thank you so much for attending, and I look forward to seeing you in the next course.
Thank you, Anna, for that valuable information. And now, for anyone interested in learning about the cushion and skin protection solutions that Direct Supply offers, please help me welcome our fantastic product manager, Shelle Wade.
Welcome, everyone, and thank you for taking a few extra moments to learn about product and how it relates to some of the key features that Anna discussed during the webinar. Today I'm going to go through 3 different Comfort Company cushions that provide either immersion, offloading, or a combination of both immersion and offloading properties. It is important to note that all 3 of the cushions that I show you today are rated through a stage 4 wound. So with that, let's jump right in. The first cushion that I'm going to talk to you about today is the Vicare Adjuster. So I'm going to open this up here so you can see. The Vicare Adjuster has these large compartments, and they're offering that immersion to your resident. So as you can see, I can really sink my arm into this cushion. There's large compartments that you are able to manipulate via the individual air cells that are inside. So let me show you one of these air cells so you can get a better idea. These are those individual air cells that, again, you can manipulate the surface of this with. Obviously, the more air cells that you remove, the deeper the immersion that the resident is going to experience. This cushion does have these 2 compartments towards the front that allow you to properly adjust for the seat to floor height. So maybe I have a resident that I want to make it a little bit easier for them to pedal around. I'm going to remove some of those air cells and thus reduce that amount of stress that they're going to feel on the back of their knees. There are 2 different cushions in the Vicare line. The Adjuster is kind of the standard, and the cushion that we're going to talk about next is the Vicare Vector X cushion. So this cushion provides both that offloading and immersion properties. As you can see, there are many more compartments to this cushion versus the Adjuster. It's also much firmer versus the Adjuster. You have opportunity to kind of build up different areas or remove some of those air cells. So I could build up the pommel here, for instance. I can remove some air cells from this coccyx region to provide some offloading here. There are these 2 compartments towards the rear of the cushion, and I can provide some offloading on those ITs. As you can see, this cushion does come with this 3D mesh liner. This liner promotes a lot more airflow, which also provides a lot better skin protection as well. A cool feature about this cushion is the maintenance. So I can remove this top cover of the cushion, throw this entire thing into a washing machine, and that's a really awesome benefit as well. So the last thing that I wanted to point out on the Vector X is that in this outer liner, it does come with a seat insert. The main function here is really to prevent sliding and maintain that proper position on the chair. So the last cushion that we're going to look at today is the Comfort Company Shield. If you have participated in previous webinars, you might have heard my colleague Kelly Sullivan introduce this to you guys. So it might be a little bit of a refresher for some of you. Again, as I stated before, this is rated through a stage 4 wound. What's really unique about the shield is that it is made up of all foam. So huge benefit to you guys in the fact that you don't have to worry about adjusting those air cells, when you unbox the cushion, and you don't have to worry about that constant maintaining of that, the proper air levels as your resident is sitting on it throughout the day. So the shield does have two covers as well. There's the outer and inner liner. Unique feature about the outer liner on the shield is the sewn in piece of fabric that would be placed directly below the pelvis of the resident. So they call this glide wear. What this glide wear really is doing is it's this stretchy material. It slides really easily over that inner layer, and all it's doing is really reducing that amount of friction that the resident is going to experience as they're doing normal movements or any of the micro movements that they might experience throughout the day. A good exercise that we do here is we kind of just take our 2 fingers, slide it against your forearm, and it really gives you a good idea of that friction that a resident might experience if they're sitting on a typical cover. And again, what the glide wear is doing is just minimizing that friction and improving that skin protection that they're going to get. So if we take a look at the inner liner of the shield, it's really for incontinence to protect that cushion. It works really well with that glide wear to mitigate any moisture that might happen. And then I want to show you the contour of the shield. So the shield does have this nice coccyx cutout here that provides some offloading for the resident. It also has some really nice contouring along the pelvis region to really promote proper posture for the resident. It has built up sides that allow for adductor and abductor control. Lastly, to note on the shield is that it pressure maps really well against competitors. So maybe you're thinking about comparing the shield versus another air cushion in this space. You can feel confident that you're going to get a comparable pressure map with both of these. That's all I have for you guys today on product. Thank you again. If you do have any questions, please don't hesitate to reach out. I know we're going to provide you with some contact information on the next slide.
Thank you so much, Shelle, for that great information. If you have any questions about the products discussed, please reach out to your Direct Supply account manager or Kelly Sullivan, whose contact information is on the slide. For more information about upcoming webinars or to view past webinar videos, please visit directsupply.com/webinars. Once again, thank you for attending today.